Funding for this edition of One-on-One with Steve Adubato has been provided by Activists in cooperation with the American Medicine Chest Challenge. Choose New Jersey. Our mission is attracting companies to the Garden State. NJIT, New Jersey Institute of Technology, Health Republic Insurance of New Jersey, the New Jersey Education Association, working for great public schools for every child. PSE&G, committed to improving New Jersey's economy and strengthening its communities. And by the Healthcare Foundation of New Jersey, founded by the Jewish community. Promotional support provided by the Star Ledger, powering NJ.com, and by Commerce Magazine.
This is One-on-One.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
People like laughing at others, so I don't mind if the other is me.
See, you go right into the character. That's what it is.
I'm bringing families together a half an hour each week. Man, I'm doing something special.
And so I do feel successful.
Okay. Welcome to One-on-One. I'm Steve Adubato. For the first time, I want to introduce you to Jane Warden, who's the Chief Executive Officer of Health Republic Insurance of New Jersey. Good to see you.
Good to see you too, Steve. Thanks for having me.
It's our pleasure. Put in perspective, Health Republic Insurance of New Jersey. What are you and why do you matter?
We're an insurance company, Steve. The first cooperative insurance company in the state of New Jersey.
What does that mean, cooperative?
Consumer-owned, consumer-oriented and operated plan. Our members will be our governing body. They will make decisions about how the plan proceeds get utilized.
How do they do that?
They will have an opportunity to vote as to the use of proceeds. As a not-for-profit, we have no shareholders. So the members will be the ones who determine, should we return, should we reduce premiums next year if we have that opportunity? Should we expand the program? Should we offer things not traditionally covered? We have, as a co-op, a mandate to innovate. The federal funding that we received suggested that we should be creative in the marketplace because there's a sense that the marketplace has not been very open, has not been very appreciative of new opportunities.
Let's put that in perspective.
Okay.
When you said the federal government created you, put it in perspective. Was it $107 million?
Yes.
From the feds. They created you, right, to do what?
They released requests for proposals.
Got it.
To develop an alternative insurance company in each state. We're one of 23 that were established.
Right.
As such, we were granted loans. They are not grants. They need to be repaid.
Is this in connection with the ACA?
It is. We're a direct byproduct of the Affordable Care Act.
Got it.
And as a result, we received a portion of that money to startup because any new business needs startup money. And to startup according to certain criteria. One of those criteria is that it needs to be a cooperative, as I mentioned, and that we need to be not-for-profit. We need to make sure that the members constitute a substantial portion, the majority of our board of directors, so that they will, in fact, make decisions as to how proceeds are spent.
And the other thing I know, because we've had offline conversations, is that you cannot spend your money on
marketing.
But you can do education, outreach, public awareness, which is how we met each other. Exactly. Because dollars are going toward public education and outreach that we're involved in right now.
Exactly.
But why not marketing and, hey, buy our products? Why not that?
The terms of the loans, and they're federal loans, was that the dollars couldn't be spent on promoting sales. So we can't bring someone to purchase our product in our promotional
The federal
materials.
government doesn't want you doing that.
No.
But why is it so important about public? It's so interesting because there's so much confusion. Because people are so, hey, I can't make sense of all this information out there. My sense is that the federal government believes that public education awareness is priority number one.
I couldn't agree more. And their hope was, and the expectation was, and in many states, significant federal dollars were allocated for just that.
New Jersey a little behind on this, Jim? Sorry for interrupting. New Jersey a little behind?
We're considerably behind. The state was given approximately $9 million to inform and educate and help the citizens of New Jersey
Could have had more.
learn more about it.
Could have had more?
That money wasn't spent. and it would be, then there was opportunity perhaps for even more. The
Hold
states
on.
that you're hearing about as rallying to the marketplace received mega millions of dollars, and it's been effective.
Hold on. In California, what are they spending on public awareness?
They received in government grants better than $900 million.
For public awareness and education,
Exactly.
about trying to make sense of this massive, groundbreaking changes, or these multiple changes with respect to healthcare, health insurance, et cetera, and New Jersey has
Spent $1 million and has $7.5 million unspent.
And in New York State?
Oh, I'm going to estimate about $250 million. You've seen, in New Jersey, we see a lot more of their ads on the television, et cetera.
What impact have we seen so far as we do this program, in 2014, relatively early? This program will be seen after as well. Have we seen a difference in terms of enrollment with respect to that?
Significant. What we've experienced is that there's a certain inertia that's hard to overcome. It's a bewildering environment, as you mentioned, for many people. What is this new marketplace? What's the exchange all about? How do I enroll in insurance?
Sure.
And we've also found that it's a very complicated process. Those of us who worked for large companies always just put a check in the box that year for what you were choosing. But we have experienced that individuals who are enrolling for the first time or trying to make a change are finding it very complicated.
But you are
so they need
optimistic.
assistance.
Sorry for interrupting, Jim.
Sure.
But you are optimistic about the long-term impact, or the potential impact of the Affordable Care Act, aren't you?
Absolutely.
Because?
It's needed. We all know that healthcare reform has been needed for a long time. We can't afford where we are with the gross national product.
Status quo, not an option.
It's not an option. So reforming the insurance programs and plans, offering more affordable options, offering alternatives, is one way to help that process of informing and reforming the healthcare delivery system in the states of in the United States.
So, Jim, when people listening to us right now, or people hear the multiple debates that continue to go on across the country, you say, this is confusing to me. You say what?
I say, be prepared to spend an hour really thinking about what you need, what your healthcare needs are, what your family's needs are, what your concerns are. Do some homework, and then go to a web page or get some information specifically to say, how do I enroll now? You've given some thought to it, so it's less bewildering. And with that, if you were to go to our web page at Health
If they went
Republic,
to say if they went to your website,
Yes.
right? Can we put it up? Right, it's up there right now. They go to your site. What do they learn?
they'd be able to understand the many different plans that are offered, the amount of out-of-pocket or deductible. They'd learn if they clicked on the page where their QualCare partner is their physician, is the hospital they prefer in the network that we're offering. They will then, if they see something that they're very interested in and want to know if they qualify for a subsidy because of their income level, be able to click on a portal that will take them to healthcare.gov, which is now functioning quite well.
That is the national
That's the national
website.
one. And that will help them determine, based on income level, are they eligible for a subsidy to pay for that which they saw attractive.
But you say the key to this whole thing is investing that hour because it could pay off big time in terms of learning what you need to learn.
Absolutely. Understanding what you're looking for when you go in. Any major shopping consideration, you usually give a lot of thought to.
People spend a lot more than an hour. Yeah, people spend a lot more than an hour than buying a car. Jim Martin is the Chief Executive Officer of Health Republic Insurance of New Jersey. Jim, thank you very much. We appreciate you being with us.
Thank you, Steve. I appreciate the opportunity to be here.
Good stuff. One-on-one. We'll continue right after this. Thank you, Jim.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at oneonone.org. Find us on Facebook at facebook.com/Steve Adubato, PhD, and follow us on Twitter at Steve Adubato.
There he is. He's been with us before. Marc Edenzon, President and CEO of Special Olympics New Jersey. Good to see you, Mark.
Steve, glad to be here. Thank you for having me.
You guys have been doing great stuff for a long time. By the way, before we even get into anything else, let's plug the USA Games coming up.
Yes.
When is it and why is it so big?
June 14th, it begins the arrival of athletes to the 21st of June.
June 14th to the 21st, 2014. This will air before and after. Huge. Why?
Well, we thought it was important for two reasons to bid on the games. One, we believe that we had a responsibility to the movement. So we thought we could bring innovation, media, and a new funding model to support the games. On the other hand, it was somewhat selfish. We believed also that by hosting these games...
By the way, you said bidding on the games like other people wanted it. Who else wanted the USA games?
We had to compete with Seattle, Kansas City, and Boston, and it was between Boston and New Jersey, and we won the bid.
Of course.
Of course.
It's Boston, it's us.
Exactly.
And what happens when everybody comes here?
Well, we're going to have 3,500 athletes from throughout the country competing in 16 sports over that entire week. A lot of special events. We expect a lot of family members because we have 20 delegations using ground transportation to attend. So extended family, friends, volunteers, we anticipate an influx of Special Olympics family members coming to the area.
What's it going to mean from an economic point of view?
It looks like it's going to be about $116 million impact over that week.
How does that work?
Well, we've booked every single hotel room from New Brunswick down to Trenton to Langhorne, Pennsylvania, over to Bordentown. So we know between the volunteers, the family members, and many of the sponsors who are going to be engaged in the event that we're going to have large participation and spectatorship.
You know, your colleague and partner, TJ Nelligan,
Yes.
who was on our sister program, Life and Living with Joanna Gagos, our executive producer, talked about this as well. So we're doing everything we can as a media partner to promote this. But I've always been fascinated by your history. Is it 37 years that you've been involved in this?
Yeah, I started volunteering in the mid-1970s. And,
Why?
Well, it was interesting. I just changed majors all of a sudden back in school and decided to go in the field of special education and working with families. And once as a volunteer, I found that there were so many opportunities. Back in '84, took a job with New Jersey, had a chance to work with Mrs. Shriver and Sarge down in Washington for 3 years.
Sergeant Shriver.
Yes, a wonderful experience down at the international headquarters, and then came back and in 1995 took over the program here in New Jersey.
The Kennedys were a key to this?
Eunice Kennedy Shriver was absolutely incredible, just a champion before her time, and really did the research in her backyard in the beginning of 1962. First national games, 68 in Soldiers Field in Chicago, were international because Sarge was ambassador to France.
That's right.
And he brought in France and Canada to participate, but just had a vision that has taken off to over 170 countries who now participate. Probably about 4 million athletes worldwide. So it was unbelievable how it started in her backyard and just grew to be this global movement.
For those who've never been to a Special Olympics event, I was fortunate enough way back in the day. I think I told you this in another interview. I was in college in New York at a little small private college, Iona, in New Rochelle. And they had this, the Christian Brothers who ran the school would mandate that we volunteered. And I don't know exactly why, but they had Special Olympics there. And I volunteered there. And I remember this young kid, his name was Marty. I don't know why I remember him. He was the kid that they connected me with. And we would run. And I remember this kid for an entire year. I was with him. I don't know why they connect you with one person. And it was this incredible experience. That happens millions of times, doesn't it?
It does.
And you never forget it, right?
It does. The fraternity of sport is pretty remarkable. Athletes accept athletes. And so what happens is Special Olympics levels the playing field. And
levels the playing field.
It's an inclusive experience. What happens now is just not the traditional sports where athletes come and then work with volunteers. We're finding now that our unified sports program, which is inclusive sports, bringing typical children and atypical children and placing them on the same teams, just being a remarkable initiative that's helping our athletes transition into the community. Bob Benjamin, who was a great volunteer for us, a corporate person, he golfs every week with Darryl Finney, competes with Darryl Finney in golf, and stands on the award stands every year in the sectional and the state events. So people from the community come out not just volunteering to help, but they come out and play side by side, our athletes.
What about your family, your kids?
It's just a lot of fun. It's somewhat of the culture of Special Olympics. I have a wonderful son who is going to be 16 years old. He has Down syndrome. We always say that if there's 12 divisions, and 12 being the lowest division, Zach will be playing soccer in that division. If there's 4 teams, he'll probably place 4th, and if he's last off the bench, it's going to be Zach. But the remarkable thing is Zachary's going to wear Montgomery uniform. Zachary's part of a team. He's part of a soccer team in the fall, volleyball in the winter, basketball. He's part of a track team, and he has his friends. And the great thing about it is not only is it his program, but we also have that unified program element where we have kids from the high school who come and mentor him and play with him and help teach him sports. So when you talk about year-round athletes, I have a daughter who's a rower and a son right now who's playing golf, but he's my year-round athlete. He's the guy who plays September right through June.
What has it done for your other children other than Zach?
I think it's really created a wonderful dimension of perspective, understanding people who are different. And it goes beyond disabilities. It's understanding your community and realizing that everybody has a worth, everybody has a talent, everybody has something they can give back to the community. And Zachary has never said anything bad about anybody. He has limited speech. He's never not woken up a morning smiling. We cherish every opportunity we have to take him everywhere we go. And you look at someone like that, and he changes our lives, he changed our kids' lives, and he changes lives around him when he goes out into the community and people get to know him.
What's it done for you?
It really taught me something different. I worked with this organization for years, and once I became a parent and understanding who Zachary was and what Zachary had in the way of needs, I realized that Special Olympics wasn't providing programs for young athletes, and we kind of broke the rules back then and started a program when he was 4 years old. And with the research and working with a great gal, Ellen Anderson, out of back then University of Medicine and Dentistry, created this young athlete program. And it's launched worldwide. And now what we do is we get those kids when they're 2.5 to 3 years old, right out of early intervention, and start getting them to play sport with their parents. Guess what? We all coach our kids in T-ball. We all coach our kids in youth soccer.
You're a coach at heart.
Well, yeah, and you love that stuff with your kids, but what happens when you have a child with a disability, you tend to concentrate more on medical needs, therapy needs, school placement, preschool curriculum, and you miss the chance to coach. So the whole Young Athlete program really connects the mom and the child, the dad and the child, and provides them the opportunity to be a youth coach. And what we hope to do is to transition that parent and athlete into age 8, 9, 10-year-old programs so that the parent is a youth sports coach, and that kid who's 2.5, 3 years old becomes a competitive soccer player when they're eligible.
I have your website up. Still looking for volunteers?
Absolutely. We have over 160 competitions throughout the year, 24 sports. We have 23,000 athletes now in our program. So there's opportunities in every community, all seasons. It's just the program just continues to grow. These games are going to put it out of the park for us.
It's going to be big.
It's going to be really big, and you know what? We're going to change the culture of how people look at individuals with disabilities. Our hope is that when Zachary walks into a grocery store or an athlete walks into a grocery store, they look at him as an athlete. They look at him as a potential person who could contribute to the community, whether it be on a competitive or recreational softball team, on a high school team, or in some job that would be available in the community. Individuals with disabilities are part of our community, and hopefully that message will come out with these games.
It's important stuff, great stuff, and we are honored to be your media partner, and we'll continue to do everything we can to promote not just the USA Games, but the work of the Special Olympics New Jersey. Thank you, Mark.
We totally appreciate your support. Thank you, sir.
It's mutual. This is One on One. I'm Steve Adubato. Stay with us. We'll be right back. Thank you, Mark.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at oneonone.org. Find us on Facebook at facebook.com/Steve Adubato, PhD, and follow us on Twitter at Steve Adubato.
Dr. Mary Jane Warden is Acting Chief of Breast Surgery at Hackensack University Medical Center. Good to see you, Doctor.
Nice to see you. Thanks for having me.
Doctor, you are a breast surgeon.
That's correct.
When did you know this is what you wanted to do professionally?
Well, I knew from the time I was in grade school that I wanted to be a doctor. And then by the time I was in high school, I knew I wanted to be a surgeon. When I was in medical school, I realized I was very interested in cancer. And then I did my fellowship in surgical oncology and limited my cases to breast.
It's interesting because there are so many different ways of looking at this, but one of the things you've told our producers is that it's important to have a multidisciplinary approach to looking at breast health and you know, really dealing with tough issues. And you said there's something called a tumor board, and I was just asking you about that. What does that mean, and why is it so important to a patient?
Well, it's a chance for us to present our cases to all the services. So the radiologists are there.
The tumor board?
The tumor board.
Who's on the tumor board?
Well, the radiologists are present, medical oncologists, the radiation therapists, plastic surgeons, the genetics department, plus all the breast surgeons. And we present every case that we've diagnosed the week before and get everyone's opinion as to what the best treatment would be.
How does that change, potentially, the ultimate, I'm not going to say, well, not only the prognosis, but the protocol? How does it potentially change what happens?
Well, you might have a patient who has different possibilities of treatment. They may have a relatively large tumor that you may have recommended a mastectomy, but there's a possibility that they could be treated with chemotherapy to shrink the tumor down and then become a candidate to save their breast, to have a lumpectomy and radiation therapy. So that kind of option would be presented to the whole board to see what the radiation therapist thought, what the medical oncologist thought.
Is the board new?
Oh, no. No, we've been doing that for the past 15 years at least.
Really?
Yes.
Is this whole interdisciplinary approach not new, but essential?
It's very essential, yes.
What would happen, doctor, if a hospital or a group of clinicians didn't do that and said, listen, I know best, and I'm not really going to consult all the way around? What would happen?
Well, in most cases, the patient would probably get the appropriate treatment, but there's some cases, like I said, where there are different options that you may eliminate one option, which would be a good way to treat the patient.
That's interesting. The patients you treat, they're from ages from what to what? Give us a sense. From how young to how old?
Well, we're diagnosing breast cancer now in patients as young as 25.
As young as 25?
As young as 25, yes.
Up to?
Up to 95.
Really?
Yes.
So all kinds of different situations. And what they face, a product of a whole range of issues, age being one of them, right?
Every case is different. Every patient's history is different. Every patient's physical status is different, and every tumor is different.
Some of the issues they face are not simply clinical or medical, correct?
That's true.
How do you deal with the other side of that, the emotional, psychological piece?
Well, it's very important to support the patient psychologically. In many cases, the diagnosis is a shock. The patient goes in, has a mammogram, thinks she's fine, thinks everything went well, and then she gets the call the next week that there's an abnormality on the mammogram and it looks like she has cancer. So it's a big shock to a lot of patients because they feel well. They don't feel ill.
How do you, I always am curious about this. How have you prepared yourself, or can you ever really prepare yourself for that conversation on your end? Because you're the one. You're the one who has that conversation. How do you?
Well, you have to be truthful with the patient, but you also have to give them hope. And in most cases with breast cancer, there is a lot of hope. Breast cancer is very easily treated now.
It is, more so than 20 years ago?
More so than 20 years ago. There are better drugs. We're doing less surgery. We're doing less mutilating surgery. We no longer have to do as many axillary node dissections as we used to in the past. A lot of women are able to save their breasts to have lumpectomy and radiation therapy.
Technology better?
Much better.
Research better?
Research is much better. There's more targeted agents now.
What do I mean, targeted agents?
Well, the medications that are directed to a specific kind of tumor. So that instead of using multiple different kinds of drugs, you can use one targeted drug, so there's less side effects.
So it's interesting. On one hand, you're being very candid. You're not sugarcoating anything. On the other hand, it's important to give hope because you want the woman to have a good attitude, to eat right, to do what is necessary to help her moving forward, right?
Exactly.
Do you have to be on some level, without the license, a psychologist?
Well, the psychological support is very important, and some women need more than others, and that's also available at our center. We have psychological support for anyone who needs it. We have support groups with other women who have gone through the same thing. And for women who don't want to go to a group, we also have some patients who've been through it,
right,
who like to guide other women through it and tell them what it's like, and that there is light at the end of the tunnel, that they will get better.
The other thing I remember is there's a celebration. By the way, is Joanna Gaggas our executive producer in the control room, because she went and produced at the Celebration of Life at Liberty. It was up at the Liberty, not Liberty Science Center, but Liberty State Park. There was a Celebration of Life that she went up there and produced. It was a great half hour celebrating in connection with your organization, with Hackensack. It's incredible women. And I'm thinking to myself, so many of these women are so strong, and that positive attitude is important. But the other side of that made me think about prevention. How important is the prevention piece and education? Because a big part of that event had to do with education. Are women smarter now than ever before with respect to early detection?
Well, there's been some mixed signals coming from the government with the...
Mixed signals?
Mixed signals, because about 2 years ago, there was the United States Preventive Task Force that recommended women not get screened until after age 50, and then only every other year.
What do you think?
I don't believe in that. I still recommend that my patients get screened at 40 and every year. At
40? Okay, your recommendation is 40 and every year.
Every year.
Because?
Because there are some cancers that grow very rapidly, not many of them, but some of them do, and a certain percentage of patients will have what we call an interval cancer, so that they'll have a normal mammogram in 2013 and they're screening at 2014. There'll be a cancer
Better
there.
be safe.
Yes.
Thank you, doctor. Important information.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Activists in cooperation with the American Medicine Chest Challenge, Choose New Jersey, NJIT, Health Republic Insurance of New Jersey, the New Jersey Education Association, PSE&G, committed to improving New Jersey's economy and strengthening its communities. And by the Healthcare Foundation of New Jersey, transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.
I will. It's the oath of those strong in character. A call to build our own dreams, not someone else's. Doing whatever it takes to create a better way. This is Health Republic, a not-for-profit co-op health plan created to give us control of our own health care. So we all have the support we need when it's time to say, I will. Health Republic. Live independently healthy.